17% of American GDP, gross domestic product, is spent in healthcare. Yet America has very poor health outcomes. We don't have a good life expectancy. There's a high infant mortality rate. There's all sorts of health disparities. And anybody who's been a patient knows that the costs are through the roof and the quality doesn't match how much you're paying. How come that's the case? Why is healthcare so expensive? I'm gonna tell you, there's a lot of scams in healthcare, many layers, and doctors are one of the biggest victims of this scam. We spent over a decade of our life going through college, pre-med, medical school 4 years, residency, fellowship. We do all this training to become doctors and practicing medicine, but then we get dumped into the reality of practicing healthcare. We study medicine, but practice healthcare. Now, healthcare, the fact that it's run by for-profit corporations, specifically insurance companies, are running the healthcare system. Now, when you study all this stuff to care for a human body and understand disease processes, then the reality is you are practicing how to bill insurance companies, how to put in diagnosis codes in the electronic medical system. And there's billions and billions of dollars getting spent, but none of it is getting spent for patient care. What it's getting spent on is administrative tasks. There are millions of administrators on so many levels shuffling paperwork back and forth. All this paperwork is meaningless for patient care. The paperwork is prior authorization for insurance. We spend hours on the phone begging administrators to allow us to order an MRI or a CT scan or get x-rays for a patient to diagnose them appropriately. We even have to haggle and beg for ordering the right medication for a patient. They even tell us to use a medication not for a specific disease, and you have to fail a crappy medication to get the medication that is meant for that disease. So a lot of paperwork is faxes and signatures and all these approvals between insurance companies and healthcare systems, which own each other. The insurance company owns the healthcare system and vice versa. They're in an open revolving door, funneling money back and forth through administrative events that has nothing to do with patient care. Now, the doctor, here's the problem. 0% of our training is spent understanding the business of healthcare. Nothing in medical school, no medical school in the US teaches students about the business of healthcare. You have to go on your own, get a master's of business or an MBA or whatever. But we don't learn how to play the healthcare game. They tell us memorize bacteria and viruses and all this information. We're forced to memorize massive amounts of information. By the time we're done with training, that info is gone. All the information I memorized in medical school, I do not use it. And in fact, it's outdated. It's expired. There's no utility in memorizing massive amounts of information because in reality, we use resources, the internet. We use softwares that help us conglomerate data and understand and synthesize problem-solving skills, and we work together and collaborate. Whereas med school, you memorize and you take a test by yourself, has nothing to do with reality and does not train you to be a doctor. But I'm not complaining about being a doctor. I'm just showing you the other side. Every time I hear doctors are paid way too much, we are really funneled to remain employees to a healthcare system, and they do not want us to be owners of our own clinics. They do not want us to be caregivers to our community and to keep our community healthy. They don't want that because that way they won't have enough people subscribing to their monthly insurance scams where you pay buttloads of money for the insurance subscription to get the same healthcare services from the same company. This is just a surface layer of the onion of one of the scams and a doctor's perspective of how healthcare is being monopolized, and a conglomeration is happening where they're buying out every private practice. You're no longer seeing any private practice groups of physicians. They're being bought out by healthcare systems and getting converted into employment. We are forced to become employees of the insurance system where we are trained to bill a maximum amount and see the most amount of patients in the shortest amount of time. There's no focus on quality of care, and there's no focus on personalized medicine. This is just my opinion. This is my observation. I'm not criticizing any specific healthcare system. I'm just telling you, if you're someone who's pursuing a path in medicine to become a doctor, understand that what you train for is not the same as the job market. But if you're creative and if you're smart, you can pivot and make meaningful impact. That's the beauty of medicine and being a doctor, and the privilege of serving patients is always there. No matter how industrialized they make it, you can always make a change in someone's life. That's a blessing, that's a privilege. Let me know what you think if you're in the game. What's your opinion about it? How do you see us moving forward? There's a lot to say, and if you enjoy this type of content, let me know. I love doing deep dives about the infrastructure of healthcare because they don't teach us this, and a lot of doctors are careless about this. They're just employees. They want a paycheck. They don't want to understand what they work for and how the business works. But try it out. Let me know. I want to empower others so we can empower the patients. The end goal is uplifting the patient, but you can't do that if you're not empowered yourself to understand the game you're playing. So play the game right. MedHustle Dr. G, I'm here for you. Give me a thumbs up or share this if you found value in this content, because I can do a much deeper dive. If there's interest, I'll put it on YouTube. Let me know what you think. Thanks for tuning in. Peace.